In-utero exposure to maternal diabetes increases the risk of developing autism spectrum disorder. Research suggests that pre-existing maternal type 2 diabetes mellitus and 26 weeks diagnosed gestational diabetes mellitus is correlated with higher risk of general impairment development in offspring, which may include autism spectrum disorder. On the other hand, the association of autism spectrum disorder and maternal type 1 diabetes mellitus is unknown. The aim of the study was to assess the association between autism spectrum disorder and in utero exposure to maternal type 1 diabetes. The study included singleton children born at 28 to 44 weeks gestation. The retrospective study included 419,425 children. The subjects were tracked from birth till any of the outcomes using electronic records. The outcomes were the clinical diagnosis of autism spectrum disorder or death due to any cause. Of the total number of subjects, 621 were exposed to type 1 diabetes, 9,453 were exposed to type 2 diabetes. 26 weeks gestation 11,922 children were exposed to gestational diabetes, and after 26 weeks gestation, gestational diabetes mellitus was diagnosed in 24,505 patients. Unadjusted annual autism spectrum disorder incidence rate per 1,000 children was highest for type 1 diabetes and lowest for the children who were not exposed to diabetes in utero. In relation to no diabetes exposure, the adjusted hazard ratios for exposure to maternal diabetes were 2.5 for type 1 diabetes, 1.5 for type 2 diabetes, 1.4 for gestational diabetes by 26 weeks, and 1.0 for gestational diabetes after 26 weeks gestation respectively. The study results suggest that the increasing rates of maternal diabetes may be a contributing factor to rising rates of ASD. Exposure to type 1 diabetes imparted the highest risk. The in utero exposures to type 2 diabetes and gestational diabetes diagnosed by 26 weeks gestation were all correlated with an increased risk of autism spectrum disorders.